Hi everyone, welcome to this episode of the Personal Finance Playbook. I'm your host, Jack Wang. Today we have my longtime friend and special guest, Scott Maibor. Scott is the founder and CEO of Senior Benefits Boston and is the Medicare expert. Medicare coverage, when properly structured, may be able to provide comparable or even better in some instances coverage than employer-based plans at a significantly reduced premium and out-of-pocket costs. Thanks for helping everyone with this important and very confusing topic. Welcome to the show.
Thank you, Jack. Thanks for having me.
Yeah, so let's get right into it. So let's just start with the basics. Right? Can you just talk a little bit about what people need to know about Medicare, right, at a high level?
At a high level, I think everybody who's turning 65 soon or has turned 65 should have that basic understanding. And effectively, if you are not covered by your employer plan from either you or a spouse, you need to be on Medicare. That's the law. You sign up, the initial enrollment period is 3 months before your 65th birthday, that month and 3 months after. It's broken up into parts, as most people know. Part A you can sign up for. There's no premium. Whether you're working or not is not relevant. Part B, though, does have a premium. And it starts at $170.10 per month this year. We'll see what it is next year. But you don't want to pay a premium if you're also covered on another health plan. So that's kind of where the, where people have to decide, do I want to be on Medicare or do I want to stay on the group plan?
Okay, so that's good to know. And so there's a special what's called a specific enrollment period. I think just open enrollment period, much like a lot of insurance policies, right? That you get through work, you have an open enrollment period to make changes. But you also mentioned that there are some parts, and I think we'll talk about this a little bit more later, but there are different parts to Medicare. I think there are 4 parts in particular, I believe. And so can you just give us an overview of what those 4 parts entail?
Sure. So from the federal government, you have Parts A and B. So Part A is hospital. So effectively inpatient hospital, rehabilitation or skilled nursing, they call it, and hospice is your Part A. There is no premium for most people on that side, on that plan. If you've worked 40 quarters in the country. If you haven't, then you may have you can get Part A, but you pay a premium for it. And it's the free one, but it does have co-pays. So the first night in the hospital is approximately $1,600. And then there's per diems after different amounts of time in the hospital. Part B is effectively everything else. It's all of your doctor's visits and your durable medical equipment and injected medications. So, for somebody in the hospital, you'll have both A and B charges. But Part B has a premium of the $170, as we mentioned earlier, and it has a 20% co-insurance. So those are the 2 parts from the federal government. Beyond that, people take Part D for the drug plan, which is required, but from a private insurance company. And in most counties, there's probably 35 or more drug plans to choose from. And that's Part D. If you have A, B, and D, most people would have a supplement. Some people know them as Medigap plans, which fill in those that 20%, for instance, that's not covered by Medicare. That would be covered by the Medigap plan. Or you go with Part C, which combines Part D and the supplement into one and effectively replaces Medicare with an HMO-style plan.
Okay, so because people can see commercials about this on TV. Excuse me. And excuse me. But I think there's some confusion around Medicare versus Medicare Advantage plans, right? Yes. Which tend to, I think, incorporate all those. So can you just talk briefly about sort of what Medicare Advantage plans are and sort of how they differ between them and regular Medicare? So
regular Medicare is known as traditional Medicare, in quotes. So you have A, B, a supplement, or the Medigap plan. And in Massachusetts, we only have 2 choices. So if you're talking to friends in other states that have the 10 lettered choices, we only have the 2. And the Part D, that would be traditional Medicare. And out of pocket, for a fixed cost out of pocket in premium, you're looking at almost $400, somewhere around $350 to $400 in that scenario. An Advantage plan, and they represent almost 50% of the market at this point, replaces all of that with the Part C Advantage plan, and all of your care is now being given to you not by A and B from the government, but by a carrier's plan. So they're very similar to the HMOs people are familiar with from work. You're in somebody's network. You have a carrier as kind of a gatekeeper for your care. But there's a lot of advantages to the Advantage plan that have made them very attractive to people.
Okay, so just to be clear, because I think that this is a point of confusion for a lot of people,
Absolutely.
is that when people are eligible to enroll in Medicare, what you're saying is that people can enroll in either traditional Medicare, or instead of that, they can use one of these Medicare Advantage plans if they so choose.
Correct.
Right? But they have to pick one of them.
Right, they're mutually exclusive. So you cannot have both. You can change in the future, of course, but if you go with an Advantage plan, you're in the Advantage plan, and typically you have to wait to another enrollment plan to make a change.
Okay. So one thing about the 40 quarters, I want to go back to that for just a moment. So I know we were talking about this off camera, but tell our audience a little bit sort of what does that mean, right? Like 40 quarters of what?
So it actually doesn't come up very often because most of the people I talk to have spent most of their lives working or had a spouse that worked in this country. So 40 quarters or 10 years of paying taxes, payroll taxes, because your Part A premiums are deducted from your payroll, from your weekly or biweekly payroll throughout your working life, so that by the time you hit Medicare eligibility, you have no premium, which isn't to say there's no premium on Part A, although people think of it that way. You've actually paid into it for 40 some odd years in most cases.
Okay. And because I know one common misconception I think that people have is that Medicare is free, right? But only, like you said, Part A is, the premium is free. There's still, there's a co-insurance piece, right, yep, of 20%. But most people, I would imagine, would just have the premium deducted from their Social Security checks, right? Much like that, when they're working, their employer premium, their health insurance premium just comes out of their paycheck, right, versus getting billed separately for it.
There's a lot. It's funny, the number of people I talk to who are very disappointed or surprised, but not in a good way, that Medicare is not free. When you're talking traditional Medicare and a monthly premium, a fixed cost of $350 plus, that's a lot of money. And for people who are expecting to pay nothing, the Advantage plans are cheaper on a monthly basis, but you still have costs.
Okay, and I know with premiums also, this gets back to the open enrollment. If people don't enroll by the time they're 65, which I know you mentioned, right? There's sort of 3 months before the month they turn 65, and then 3 months after. But outside the enrollment period, if they don't have something else going on, they're actually subject to a penalty.
Correct. So you get penalized if you don't have what they consider creditable coverage from either your employer or your spouse's employer. You will be penalized on your Part B, and most people don't realize, and your Part D gets penalized as well, and that penalty is permanent. So once the penalty is assessed, that penalty will be with you forever unless you qualify for assistance in some way.
Wow. So I think, that brings up a question, because I think a lot of people have heard that. I know I've heard that quite a bit from others. But I think the big question then becomes, well, but Scott, what if I'm still working at 65, right? So I have coverage through my employer. But then I've heard all this stuff like, oh, but if you don't enroll by 65, you get penalized for life. Right. So what's the real deal, and sort of how do I, can I drop my employer coverage to go with Medicare, or do I have to keep my employer coverage, and sort of what happens then? So
at 65, as long as you are covered by either your employer's plan or your spouse's, and this is a big caveat, the employer has to be larger than 20. So if you're working at a small employer, Medicare is a requirement. As long as you have coverage, Jack, you do not need to do anything with Medicare. So all the people who are telling you about penalties for not having Medicare, or you have to sign up for Part A, as long as you have coverage from your employer or your spouses, and it meets the creditable coverage requirement so that it's a minimum level of coverage, you do not need to do anything. Many people sign up for Part A while they're working and staying on the group plan because they figure if paid into it, it's free. You know, there's no premium.
Free, quotes, free.
Yeah,
right?
I mean, so they probably don't, in most cases, unless they have a really high deductible on the group plan from their employer, they don't get much out of it because it's only going to pay an inpatient hospital, and it's only going to pay after, you know, the other stuff is satisfied. But are you going, you know, is there a harm in doing it? As long as you're not paying into a health savings account. So as long as you don't have a health savings account that you're actively contributing to, you can sign up for Part A. All of that said, if you like Medicare better than your employer's plan and you're 65 years old, you have the right to sign up for Medicare.
Okay, so let's talk a little bit about that, because, you know, people are able to work a lot longer these days, right? So plenty of people say, well, I want to work till I'm age 70. So let's assume for the moment that someone stays on their employer plan because they like it, you know, they like the doctors they have or whatever, right, or their spouse's plan. But they're obviously past 65 now. So they work till age 70, they're retired age 70 or whatever the age they retire. They drop their employer plan, but now they're well outside the 7-month window that encompasses age 65. What happens? So
the 7-month window that you refer to is called initial enrollment period, the IEP, and that's a once in a lifetime thing around your 65th birthday. But you have, off the top of my head, about 43 special enrollments, so SEPs, special enrollment periods, where things like losing group coverage, involuntary loss of coverage, you know, divorce, losing Medicaid, gaining Medicaid, any of those types of, you know, that whole list, and they can be weather related. The Medicare Center, CMS, the Center for Medicare, can declare a weather emergency, and that could be an SEP. So there's a whole bunch of reasons when somebody can sign up. So somebody retiring or their spouse retiring, you know, I see that a lot too, where the spouse that carried the insurance is the one that's retiring. You know, and the other thing, you know, you mentioned something, Medicare starts at $170 per month with no deductible. So if you're paying more than $170 per month on your group plan from your employer, or you're carrying a spouse, and, you know, especially a company that only has a family plan, are you better off looking at Medicare? Possibly. Certainly it's worth considering if it's an option.
Okay, so in that example, I just want to clarify. So if it's, let's say, just a husband and wife, or two spouses, right? And what you're saying is the employer might have just two levels in their coverage, a single person or the family,
right.
But now your kids are grown and everything else, right? So it's really just you and your spouse. What you're saying is it might be worth going single for health insurance purposes only, right? Not single for marriage, but single, and then that spouse going on their own Medicare.
Absolutely. So in a lot of cases, you have people automatically assume that, you know, if they're paying, you know, $500 a month is just a number out of the air, that if my spouse gets off my plan, I'm going to be paying $250. But that's not always the case. You could be going from a family plan to an individual plan. The company is required to pay 50% of the employee's health insurance, but zero of the spouse. And depending on how the benefit package is set up, you may find that you're paying $500 for a couple per month, but if just the employee is on it, it's $75 a month. And then you do the math and you're like, wow, I'm paying $425 a month to cover my husband. He could have a full traditional Medicare plan and still save money and have no copays, no deductibles, no network, and have all of those advantages of Medicare.
Right. Okay, so that makes sense. And you know, I don't think a lot of people think that way, right? Because health insurance is one of those things, like, you know, everybody complains about the costs, right? But at the same time, you want to make sure you're covered for stuff, because God forbid something happens, you don't want to go without. But I don't think, or at least in my experience, I don't tend to know a lot of people who are very strategic around their health insurance. But what you're saying is you can really put some thought into this, potentially, right, and go with options that could save them a lot of money.
You know, when I'm talking to financial planners about their clients, and they say, well, you know, they're not on Medicare, they're still working, and I said, they're not on Medicare because they're afraid. It's fear of the unknown. For most of us, and you and I are kind of exceptions because we've been self-employed for so long, most people have never shopped for health insurance. Their HR director, their CFO, somebody at the company says, here are your options, A or B, or just A, and you sign up and you're done. And every year they're going through the purchasing process and you just sign yourself up. Then you retire, and all of a sudden we're saying you now have to be a health insurance expert, because for the first time in your adult life you have to pick a health insurance plan with no guidance. I mean, there's 35 Advantage plans in your county. Which one's best for you? And you know, and then you have a case where Massachusetts has a different system than other states, so that adds to the confusion. So you just have a lot of these issues. But to hit on something you mentioned, if somebody's very healthy, Medicare may save them a lot of money. If somebody's very unhealthy, and I'm talking about over a group plan, Medicare may be the best thing possible for them, and it may save them a lot of money again, because you have a completely different health structure with Medicare than we do in this country for working age people.
Right. And because at the employer level, I know that the premium that the company pays, that the employee pays, they sort of have to average in like everybody's health, right? So if you're super healthy, you're probably paying more than you need to because you're sort of paying for all your employees who are super unhealthy. But if you're super unhealthy, you might be, you know, you might save money to go on Medicare, but at the employer plan, you might be paying a little bit less because you're getting, you know, sort of the benefit of everybody else being healthy. But, you know, one thing you mentioned is health savings accounts, HSAs. You know, more and more people now have high deductible health plans, right, where they can contribute, or their employer contributes on their behalf to a HSA. Talk a little bit about that and how that works with Medicare.
So basically, there's a lot of confusion around it, but in terms of people don't, I think there's a lot of misinformation, because I see a lot of HR people telling somebody who's turning 65, you have to sign up for Medicare, which as mentioned earlier is not the case. But they're being told at 65 you have to sign up for Medicare, Part A, stay on the group plan, sign up for Part A, but they're also either themselves or the company is contributing to a health savings account. And that is a violation of Medicare code. So now you have a tax code violation, because you cannot have Medicare and have an HSA. And you know, it comes down to Medicare is partially income-based in terms of pricing. And if you have an HSA contribution, you're lowering your effective tax rate. So it gets into those weeds, but you can have an HSA, to be clear. It can grow, you can manage it, you can use it for your expenses, you just can no longer contribute to it 6 months prior to signing up for Part A is actually the rule. Okay,
all right. Yeah, because I know that, again, before we came into the studio, I know we were talking a little about that and how it can be very confusing for people who have that type of plan and that type of account. Let's spend a couple of minutes just talk about Advantage plans. I know here in Massachusetts you said that there are 2 Advantage plans, but at a high level, right, because I know some states have many more, but at a high level, what are some of the major differences that you see among different Advantage plans, like features and stuff?
So just to be clear, there's 2 supplements and 30 somewhat.
Oh, okay. Sorry, okay. Yeah, I got that wrong. All right.
So
thanks,
every carrier has multiple Advantage plans. So, you know, not to pick on a particular carrier, but Tufts probably has 7 of them, and they have new ones coming every year. So, you know, and United has probably 10 of them in Massachusetts. So the big difference between the Advantage plans and what I've seen in the years I've been selling Medicare is the trend on Advantage plans is no premium, which is what makes them attractive. And I mentioned earlier, Medicare starts at $170 a month, because if you have an Advantage plan, you have no additional premium. You pay your Part B, the $170.10. You have no additional cost, fixed cost. So you have a drug plan, you have dental and vision, you have full medical coverage, with deductibles and copays, but no premium. So imagine the plan you have from work with no health deductible, no drug deductible, and no premium. So when you're comparing Advantage plans, what I always say, and I was at a carrier meeting at the end of last week. They're newer in the state. They came in last year with an Advantage plan, or several. They have 5, I think. And they actually have something called a Give Back plan, which we can talk about. But they have multiple plans, but they have no doctor network. So do I think their plans are great? Absolutely. But I always look at, when I look at an Advantage plan for somebody, I look at what county do they live in, because the plans are county-based. So I live in Suffolk County. You live, I believe, in Middlesex. Yep. We have different plan options. Same carriers for the most part, but different plans. So that's number one consideration. Number 2 is what medications you take. Because every one, for the most part, every Advantage plan has a built-in Part D drug plan. Well, they're all going to have different copays. So you and I could be on the same medications, but 2 different plans have 2 different copays. I like CVS, you like Walgreens. That's a different copay. I could tell you you're a Walgreens guy. I could tell you to go to CVS on your current plan, and it will save you $50 a month. Whether you opt to do that or not is up to you. Mm-hmm. And then the third piece is what plans does the doctors you would like to see this year, what do they take? It's great to say XYZ plan has the best benefits and it's the best coverage and it's the highest rated. If your doctor doesn't accept the plan, unless you're willing to change doctors, it doesn't do you any good. Right. After that, all of the ancillary benefits that you're getting yelled at on TV by Joe Namath and William Shatner and J.J. Walker, when they're talking about free rides and free meals and give back money and dental, all of that, all the ancillary benefits of the plans, they're all pushing those. But in my opinion, and I tell the carriers this all the time, I don't care what your dental is. One of the carriers they've just upped their dental more than everybody else. So you have an annual dental benefit of $2,000. Everyone else is around $1,000. But they have a dental network that I can never find a dentist in. So it's great they're giving you more money. Good luck finding a dentist that takes it. So you can't really use it. So to me, first thing I look at, what's your doctor network? Because your doctor, and I tell people this all the time, don't blame me if you want, plan A, but your doctor doesn't take plan A. Your doctor chose the plans, or the network he's involved with chose the plans. If they only take plan B and C and you really want A, don't blame me. I'm just telling you he's not in the plan or she's not in the plan.
Right, it's interesting you bring that up, because I see all the time, especially on social media, people ask for all sorts of things on social media, right? And recommendations for Medicare Advantage plans is something that I see from time to time. And you bring up a great point where, a lot of the people comment and say, well, Company A has a great plan, right? Or I really love Company A, right? But what you're saying is Company A might have 10 different plans. So it's not just Company A. Right. It could be plan number 1, plan number 2, plan number 3, right? And what you're saying is it might be right for that person, but it might not be right for you.
Absolutely.
Or me.
And some of the plans have discounted insulin. Well, if you're not taking insulin, that may not be much of a factor for you. But if you are on insulin, you certainly want to plan with the discounted insulin. Something that I thought was interesting at that carrier meeting, they have a 0 premium plan. They also have an Advantage plan, which is around $50 a month. Their argument is the $50 a month plan gets you $4,000 in added benefits, the way they're counting them. Is that worth $50 a month? Maybe. The trend is to 0 premium, though. So, and you could have a doctor in, a plan that has 7, a carrier that has 7 Advantage plans in a county. The doctor's in 3 of them. Same carrier, but they don't take all the plans. So you have to make sure that the doctor you want to see is in the plan you want to use.
So, Scott, we just have time for one last question, and I think this has been really great information. But what is one final tip, or perhaps maybe one common mistake that you see? And what's one final tip that you can share with our audience?
So I think We're almost at open enrollment period. It officially starts October 15th to December 7th. That is your window for somebody on Medicare to make a change. And the 2023 plans are available to speak about as of October 1st. So that is your window, October 1st to December 7th, to see if you are on the best plan for yourself this year, or next year, technically. The plan you're on may have changed, your doctors may have changed, your medications may have changed, your needs, budget may have changed. I can't encourage people enough to take advantage of open enrollment, because the biggest problem I see is inertia. I see people overpaying for plans all the time. I ran into somebody the other day with an old supplement. It's 5 times the price of a modern supplement. He's had it for 15 years, just never bothered looking. You know, is the drug plan right? Are you going to the right pharmacy? Make sure, because once December 8th comes, you're locked in, and what happens is people go to the pharmacy that first week of January and realize that their formulary has changed, but now it's too late to change. You're stuck for a year.
Right. That's a great tip. So I think the key message, right, the big takeaway for me is there are a lot of good, all the plans are good, but not every plan is right for a specific person. So thank you so much, Scott, for that great information. I know it's super helpful, because this is such a confusing topic, and it can make a huge difference in people's lives, right, if they have a good plan but not the right plan, right? Thank you all for watching this episode of Personal Finance Playbook. As always, stay safe, stay healthy, and we'll see you next time.